Thank you very much. Alicia Diaz with CNN, CNC, a national Latino organization. I couldn't help first of all, I commend HHS for making this day possible.
Thank you.
It's been a long time coming. I want to go back to the 3 states, Florida, Texas, and California. I couldn't help but think that those are the 3 states with the largest Latino populations. And that historically, Latino communities, families, children have been left behind in programs that they're eligible for, but not enrolled. The SNAP is an example. Health programs that they're being eligible for is an example. And now, because they're bearing the brunt of the downturn, they're the largest at the unemployment lines. So 2 questions. One is, what efforts are in place and who are the responsible partners to reach out to Latino communities? What specific efforts are in place? How can other organizations enroll? And 2, is there, because of the unemployment disproportion, is there a plan to create a partnership with Secretary Solis over at the Department of Labor, similar to the one that you have with Secretary Duncan? Thank you.
Those are a lot of questions, but all really good. So thank you for them. Let me answer a couple, and then maybe turn it over to one of our national partners. But you are absolutely right that there is a disproportionate the uninsurance rate among Latino children is disproportionately high. And it is an area that if we are targeting based on our knowledge, based on our data, we know we have to do a much better job closing that gap. And I think the part of the reasons for looking at the data closely, as well as for forming strategic partnerships, is to focus where the need is the greatest. There are many different tools that can be used to be able to reach families. And one of the new provisions that was in the CHIPRA legislation that we issued guidance about a couple of weeks ago is an enhanced federal match, more federal dollars to states as well as to healthcare providers to provide translation services, interpreter services, both in the enrollment and the renewal process, as well as in the provision of healthcare services in a health clinic or in a doctor's office. So we know language barriers are one big part of the problem, and that extra federal support I think will help. But it's really a question of targeting, and it's really a question of partnership. One of our national organizations here today is the Council of La Raza. They are working very hard with us and with